This is what it feels like. I'm you. This is what it feels like. And let's go. Really good afternoon to Joe here. We also play Love Inc. and You're a Superstar. Right, come up next. Jess is here. The music. I want to talk about weather in there as well.
Alexa off. Need it to be looked at, well, look no further. Here at the Rehab Hub, we are offering a free consultation where you can come in and see one of our podiatrists for 15 minutes at no cost to you. Hi, I'm Sarah Jane. I'm the Clinical Director of the Rehab Hub, an MSK podiatrist and Pilates teacher, and we are offering you a free consultation where myself or one of the other podiatrists here will assess you and give you the best possible advice and at least give you that diagnosis of your verruca. We have many options here for verrucas if it is a verruca, so rest assured you're in the best possible hands. If you would like a free consultation, just book below. You'll get 15 minutes with your podiatrist who will give you the best advice and give you at least that peace of mind that it is actually a verruca, a plan going forwards, and that might mean no treatment from us. It may well be we have those options there as well, but it might mean that we just give you that advice completely free of charge. Please just book below and we'll help you as best we can. about ingrown toenails. Possibly it's ingrown, possibly it's a fungal nail. So if you don't like yucky stuff, then switch away. If you have any questions as I go through this, please feel free to comment. I think you need to authorise wherever you're watching this to be able to comment. But even if you're watching it in replay, please feel free to message us over. So here we've got a picture of definitely an infected ingrown toenail. And you can see it's bilateral, it's both sides, it's the medial side and the lateral side of this particular patient's nail. And actually this was a one that I fixed just last week and we worked on and helped the body fix it. So we can see there's been a bit of infection. This particular patient was suffering with an ingrown toenail that they had had for a number of years and had been off and on antibiotics. And if you've watched any of my other lives, you will have heard the chat about antibiotics. We'll maybe go over a wee bit more about this later on. But yes, essentially infected. And we can see from some of these other ones here, we've got an involuted toe, which is the one on the right hand side. So see it's really curly, and then you've got one that's ingrown, really localized infection there as well on that kind of bulgy red part. So you can see that kind of red, swollen, angry. Now, in terms of what we can do for these, for some people we can conservatively treat them. That means that we wouldn't need to do any surgery on it. Meaning that, and we'll talk a wee bit about the surgery during this presentation, so we'll kind of debunk some of that for you as well. But essentially we don't always need to perform surgery to fix these. There's sometimes if we catch them early enough, we can tidy these up fairly, or kind of help you with them fairly easily. But depending on, so you can see the one on the right is a completely different shape to the one on the left-hand side of your screen. And this really will impact on what type of procedure we would be able to perform. Now, not everybody gets an ingrown toenail. So you can see here again, localized infections. I don't know if you can see my little movement going on the screen here. You can see that red, hot, swollen. We've got that kind of granulation tissue starting to build. So there's definitely something needs to get done with these. And usually your GP or likes would give you antibiotics, and that definitely isn't the solution to this. Now, another reason that you might come and see us with nails is a fungal nail infection. So this is what generally a fungal nail infection will look like, and sometimes we might do nail surgery on this to resolve ongoing, just absolutely nightmare fungal nails. Now, the one on the far left, we can see it's almost the full nail, and actually this particular patient, I did do surgery on this, and we removed the nail fully to allow, she was demented with it for years, and so we did nail surgery on this. It had also been digging in and annoying her. She didn't have any infection, as you can see, but it was something, this particular patient was in her 50s, and this had been going on since her 20s, and she just was like, she was done with it, she wanted it gone. And for this particular patient, we did phenolise it. She didn't want the nail to grow back. She was at the end of her tether with it. It would get to a certain point. She'd be seeing podiatrists for years, like 30 years, managing this. Probably spent, I don't even want to imagine how much she'd spent over those 30 years getting this conservatively managed. So she came to me and we removed it fully and phenolized it, so it won't ever be a problem for her again. So there's different options depending on what you're looking for. The nail, however, to the right of that one is a wee bit different. You can see there's like a little line on it, and that's where we've no doubt been we've drawn that on to show the line of demarcate where the infection, the fungus stops. And with a nail like that, that's actually a good candidate for what we do, the lacuna method in clinic, where we would drill into that fungus and treat the skin underneath. So that actually, I wouldn't go to surgery for that. I would treat that conservatively, that fungal nail, rather than taking the nail off, because there's a good likelihood that if we treat the skin, the associated fungal infection, treat the footwear, make sure that everything is in the right environment for this particular, to get rid of the fungus, and then treat the skin underneath that nail, then there's a good case that actually will work really, really well for that patient, because it's not right back into the matrix, so no need for surgery. However, if you look at the far bottom one, the bottom right corner, that is just, yeah, that needs to come off, doesn't it, if possible? So that is, it's thickened, it'll probably be all crunchy and just like flaking, and yeah, it's just, that needs to be dealt with, and it's probably quite sore, I would imagine, as well. And they do tend, some of these kind of grow up the wheel almost like a horn. Can make it wearing shoes really uncomfortable. And then because they get so thickened, there's then a risk of, because of that pressure on the skin underneath, there's a risk of ulceration underneath those nails. And that's something we can see in clinic, where you've got older patients maybe where they've their nails, your nails do tend to get thicker as you get older, and fungal infections tends to be associated with people who are older as well. So what can happen is this build up of the nail and the pressure on that kind of skin over time. You know, they might not even feel pain if they've got peripheral neuropathy. They're maybe not feeling and have full sense on their feet, so they might not actually have pain. It might be that something's coming out of their nail, or it just looks a bit funny, and then you're then treating that, and then you find an ulcer underneath it, and that's never a good thing at that point. So thickened nails should always, you want to file them down. You always want to keep them thinner, because of that build up of pressure, and that pressure can then basically damage the tissue underneath and leave you with a wound, and then it can then become that chronic wound that is then classified as an ulcer. So it is important, because then you're then dealing with something that is pretty serious by that point. And well, this presentation isn't going into ulcerations, but it's a serious thing. So we don't want to be leaving that sort of thing. So make sure that, certainly if you've got older relatives, that you are checking these kind of things. I know feet are not the most attractive things, but even if you just get into your local podiatry practice, or somebody that will do DOMs if they're not able to get out, do take the time to have somebody look and check these kind of things. These are the kind of things we're checking for. And just because somebody's not moaning about being in pain doesn't mean to say there isn't an issue there, because they might not actually have the sensory input there. They might not actually have the ability to feel pain. So yeah, always get that checked out. But that's another candidate for nail surgery, would be a fungal infection, actually, and that's something that we treat. Right, we alluded to this in my last presentation. We spoke a little bit about antibiotics and the use of antibiotics with an ingrown toenail. And I'm not saying they don't have their place. They of course have their place, but they shouldn't be the first line unless there's an absolute reason that they need to be. And this is usually what people will go on. They've got an infection and they'll go on antibiotics, and it's not always necessary, because it's like you're not taking away that problem. And as I said in my last presentation, it's like I've left a knife stuck in you, whether it be your toe or whatever, and I'm not going to take the knife out. I'm not going to take that big jaggy bit of nail out of your toe. I'm just going to leave it in there. Like if I've just left this knife in there, and I'll give you antibiotics to clear that infection, but I'm not going to remove the actual problem. And the problem is the nail that is stuck into the tissue. So the problem isn't the actual, the infection's there because there's a foreign body sticking into your tissue that's then allowing a portal of entry, that's allowing that infection to then happen. So we need to remove the nail, the knife, and allow the body to heal itself. And actually, in the majority of these, I mean, to be honest, in my time doing these, it's very rare for me to have to give somebody antibiotics to deal with this. The body is very equipped. If we just remove the problem, the body is more than able to deal with the fit, active, healthy people, deal with the infection itself. And if not, we have the antibiotics there, but it shouldn't be a first line thing. Let us remove the nail. So when we're talking about nail surgery, what happens, and nobody likes needles and things, so we do have to put the toe to sleep. We have to anaesthetise the toe. We use local anaesthetic. It's a really small needle, 30 gauge needle, really, really small. And we have two little jags, one on either side of the toe, because we have to deal with both of those nerves. And it's two different branches of nerves. So that's why you get two injections, one either side. It is a wee bit stingy. That's probably how I would, it's almost like maybe feeling like you've got vinegar in a little cup. It's got a bit of a heat to it. It's not horrendously painful, but it is a wee bit stingy. So it's not completely painless. For kids, we can use things like Elma cream just to go over that initial scratchy sensation. But usually when you've got somebody, certainly a young one, that has got a really horribly just sore toe, right? They are demented. It's so sore. These things really are sore when they get infected, and pus and things coming out of them. You just want to get it dealt with. So it's over with really, really quickly. It's a few seconds, and then the toe won't feel anything. Right, in terms of what happens, we have different options. So within the Rehab Hub in Glasgow, we are a team of podiatrists. We are used to doing this in a, if not daily, weekly basis. And we can do what's called a partial removal, or we can do a full removal. We can use Pheno, where we stop the nail growing back if you're wanting a more permanent solution, or we may choose not to use Pheno. So in this particular image here, this is a partial. So you can see what's happening here is we're going down the side. So say, for example, that was the side that was causing the problem. We would go down with our sterile instruments and we would remove the problem. So this is like we're removing that big bit of nail that's sticking into the tissue. So imagine what I spoke about earlier, that big knife that's sticking into the tissue that is causing the problem in the first place. We are basically removing that. So we need to numb your toe up before we do that. We then remove the problem. And then at this point, we've got a choice. We can choose to just allow the nail to grow back, or we can, at this point, choose to put a solution on the nail, which is called Pheno. And Pheno burns the nail cells. So essentially, we are trying to ensure that you won't get this problem again. Now, with partial removals, which means we're only taking a slither of the nail out, the body of research that is out there, and also from working within the NHS, what I can say is that the majority of patients that come back for a second surgery are patients that have had a partial. Now, I'm not saying it doesn't work, but it's generally it's less effective than taking the full nail off and phenolizing it. But we appreciate that many people will want to keep hold of their nail. They don't want to not have a nail. You don't need your nail. It really doesn't have any purpose at all on your feet. It's there as it really doesn't do anything. So it's not going to cause you any disability. There's going to be no weird sensation if you don't have a nail on your big toe. And if you've got recurrent problems with that, that's a conversation that we'd have with you and get the best plan for you. But know that we can do partials, and we can do full removals. We can do removals where we don't put any phenol on it. Maybe there's just been trauma, and it's just the situation with the trauma that's caused the problem in the first place. So we just want to deal with that and then let the nail grow back, hopefully as new. Or there might be something that's ongoing with your particular shape of nail, some sort of damage you've had long term, that you need a more permanent solution. So there's everybody's different, but know that we have those different options there. And you can see from this picture, we've got the little blue thing around the toes as a tourniquet. That's on because we need to stop the blood flow going in, and especially if we were going to be using Pheno, we would want a tourniquet on because we don't want the blood to come down to essentially dilute the Pheno solution, because that would make it less effective. So if you're trying to burn off those nail cells, we don't want the solution diluted, so blood would dilute that. And also it gives us better visual. It just means that we can see what we're doing, we can make sure everything's out. If you've got loads of blood coming down in an area, it makes it less difficult to be. It basically means your visibility there isn't great. So we usually will use tourniquets, but the primary reason we're using that is if we're phenolizing, we don't want the blood to dilute the Pheno. So that's really the main reason we use it. And then from here you can see this is me actually removing one of my colleagues. This is me doing a surgery, and this was actually for a fungal nail. And I want you to just notice on that how wide that nail actually goes. And I think that's most of my patients don't quite appreciate how wide your nail actually is. So that's what we need to take out. So when we are, if I jump through to that again, when we are removing that nail, if you imagine trying to get into that without numbing your toe up, there's just no way. And you can see the green tourniquet here that I've got on with this particular patient, and that's my artery forceps. I've already been up and cleared out before going up with the artery forceps to then get a nice clean pull away from the nail bed to allow that nice clean removal of that nail. And that particular surgery that I did, we actually chose not to phenolise this particular patient's nail because it was a fungal nail, and then what we did was we allowed the nail to heal, and at the same time as that we then treated the skin around the toe with a fungal treatment, so that, and actually this particular patient's got a really lovely toenail, which is an ideal situation. So there's different reasons for getting nail surgery. Usually it's infection and ingrown toenails, but not always, and I wanted to just make that clear. Sometimes having a fungal nail would be your indicator. The difficulty is, depending on your fungal nails, you might have all your nails might be fungal, and that's maybe a bit much to take them all off in one day. But it's not that we couldn't do it, we just probably wouldn't do that all in one day. That's maybe a bit much, but it can be done. When you're leaving for surgery, this is usually what will happen. We'll usually put a primary dressing on, then a secondary dressing. Primary dressings with us, it just depends. We'll usually put on a bit of Ottoman to stop the dressing sticking, and then we might put something on. If, say, for example, when we've maybe had some granulation tissue to cut away, there's maybe been some soft tissue work, scalpel work underneath that we've had to do, and that can sometimes just mean that you end up with a wee bit of bleeding, post-op bleeding. So we will sometimes use a dressing that will help with the bleeding control, and then we would then put on some sterile gauze, and then we would dress it up just with basically a little dressing to hold it all in place. And you usually leave that on for just 24 hours, or sorry, 48 hours usually, 40 hours with that, and then that dressing is then removed, and then it just goes to a sterile plaster after that until it scabs over. So that is it. The nail surgery isn't just for ingrown toenails. So I wanted to get that across in this presentation, this live that I was doing with you. That's been something that people have asked us. I've got a few phone calls this week about that, like, why would I get nail surgery? Why wouldn't I? Nail surgery it certainly shouldn't be taken lightly, and it's not something that everybody will be able to get, because depending on your health status, if your blood supply to your lower limb isn't great, or there's various different reasons why we wouldn't be able to do it. But for the vast majority of healthy young people, it's not a problem. Actually, a couple of patients I had last week were in their 50s, and then also had a young girl, actually quite young. She was 12, that particular patient, and just absolutely, and I like just, it's always tougher with the younger patients, because probably the hardest bit is the injection. But we were very patient in clinic, and that particular patient took us a wee while to get an injection in, but we got it in, we got it resolved, and it's we're absolutely thrilled. Our mum and dad are absolutely delighted. But it was, we are, I suppose what I'm trying to say is that we're very used to it, and we're also very patient. And if we need to get you back and things with that particular patient, we sent her out for a hot chocolate, and just to kind of get ourselves psyched up, and then come back in an hour, and we did the procedure. That particular patient was just a wee bit nervous, and we'd booked them in a particular time, and she was just a bit too frightened to get the injection. So we gave her a wee bit of time, and then she came back an hour later and had the procedure, and everything was fine. So we're quite good at dealing with wee ones, and we're very patient. So if that was a worry about you, we're generally always going to do our best to help as much as we can and make it a calm situation. And I mean, it's not nice. It's not nice for anybody. It's never nice getting an injection, but we're very quick and we're very skilled at doing it. We are the lower limb specialist podiatrists there is nobody better to perform nail surgery than a podiatrist. It is something that we are heavily trained in during our degree. It is something that we do daily. So it is, don't put up with a big
horrible sore toe. You don't always need surgery on it, but please don't worry if you do. We can absolutely help you, whether you're in Glasgow or whether you're further afield. Look out for your local HCPC registered podiatrist. So if you go into the HCPC register, which is the Healthcare Professional Council's register. So as podiatrists, we are healthcare professionals. We are regulated by the government. So you can find your local podiatrist by just going on to the HCPC website, and you'll be able to check, you'll be able to go into the podiatrist list, and you'll be able to get a list of local podiatrists. You can also get that from the Royal College of Podiatry, and depending where you are in the UK, you'll be able to do a search for your local HCPC registered podiatrist who'd be able to help you out with that if you're not in Glasgow. But that's it. So nail surgery, not as scary as maybe you would think. It's something we can absolutely help you with. Usually appointments, we can usually see you. I mean, if it's an emergency, if we needed to see you the same day, we would generally try and fit you in. If not, usually within 24 hours, we would usually top and tail you at the start or the end of a clinic. Even if we were fully booked, we would see you just if there was infection there. With, so we would generally and help the body fix it. So we can see
SJ here, Clinical Director of the Rehab Hub, and welcome. So we're going to talk about verruca. And this, we are introducing our latest, our newest piece of technology into the clinic, and this is for those pesky verrucas. So if you're struggling with pain, if you're embarrassed maybe about your verrucas, and maybe you've tried everything, maybe you've bazookaed that verruca until the cows come home and it's still there, possibly even spreading. The number of people that I get in, especially young people who are just so embarrassed about their verrucas. Maybe it's their relationship that they're in. Maybe it's that it's a young kid where they're not even allowed to. They've got to wear the verruca socks and maybe don't want to go swimming. Self-consciousness. And some people, maybe they're finding that it's sore, that's actually starting to hurt. So please don't put up with it. There are solutions, and this is where we've brought in Swift. Now, we have a fantastic success rate with verrucas. To date, every single verruca that we've had in, we've managed to get gone. Now, that is because we are utilising the best research that is out there just now, that is available for this. We are always in talks and looking out and bringing the most innovative ways that we can get rid of these pesky verrucas for you, our patients. We brought Swift into our clinic to join our options for verruca, and this is going to be our first line option. We do have a surgical procedure for verrucas as well, which sometimes we have to go to for very, very stubborn verrucas. But most of the time, our conservative treatment is enough. And I would say that for just about 95% of the patients that we see in here, the majority of them, first line is all they need. They very, very rare that they need to go to a surgical procedure. And even if you have failed in the past, I promise you, you have not tried everything. So what we do in here is that you come in, and because we are just launching this latest treatment to the clinic, we are offering a free consultation. So if you've got a verruca and you're just demented with it, you don't know what to do, you don't know what the right treatment is, and maybe you've tried some other stuff before, maybe you've been to other podiatrists and you've failed with it, please don't let that stop you. Please reach out to us. We want to give you a free consultation, and I promise we will always be open and honest and transparent. And if we can help you, we'll always say we can. And if we can't, we'll always be very honest with you, and we will not treat you if we don't think that we can help you. Now, we've gone for Swift because a few different reasons. Now, prior to using Swift, our conservative treatments, our non-surgical procedure, was utilising a solution that we put on that essentially mummifies the verruca. Now, we've moved away from this for a few different reasons. The main one was what we found was happening was there's not a lot, but you had to go home and do stuff every single day, twice a day. So and if you didn't do what we asked you to do, then your results would basically are going to go down. And what would happen is you then have to come and see us more often, and therefore spend more money on this treatment. And in some cases, we were seeing people 6, 7, 8 times to try and get this verruca resolved. And actually, in one case, I'm sure it was about 16 appointments before we got them resolved. Now, that's a lot of investment in certainly your time, but also financially. So that was a kind of the finance behind that conservative treatment. It was getting to be, we'd eventually get there, but the journey to there was quite costly for the client, and also meant they were coming either weekly or fortnightly to us. That's a big financial burden and a big burden on your time. Swift, however, what happens with Swift, this will be our conservative treatment, and we're taken away from the mummification solution. What happens here is you'll need 3 appointments, and that is 80% of the clients, or the research that's been done with Swift, 80% of verruca are cleared up in 3 appointments. I know that sounds, you might be like, aye, right. But this is where the evidence is. Now, what this is doing is it's microwave technology. So essentially, we are damaging the tissue through basically putting this microwave into that tissue and allowing your immune system to then come and deal with the virus. The verruca is a human papillomavirus. So your immune system will then come and basically deal with that virus. Now, what happens, 3 appointments, you come, and the actual treatment, we apply this to your verruca, and there's a little tip that goes on the end. They're all single use, so there's certain little tips that go into this, and they then are disposed of afterwards. We don't use that again in anybody else. And then from there, what happens is the actual applicator is only on your skin for 2 seconds. It's really, really quick. Now, it is hot. There's no smell. There's no burn. There's no smoking coming off you. You'll just feel it hot. And then that's it. And then we do that usually between 3 and 5 times during that appointment. If you've got satellite verrucas, we will treat all of them as well, and we'll do that in all of those areas, as much as basically you'll tolerate. You'll usually have, if you've got quite a lot of them, some patients that we see with verruca, they've just got, their foot's just covered in them, but there's usually almost like a mothership of them where it's kind of started and then it's kind of gone out and spread, and they do spread. They're absolute nightmare for spreading. So we will go for the big mothership and all the little satellites around. You then see us a month later, and it's a little package. So essentially you see us initial appointment. So you would come in for a free consultation. We would tell you your best options, whether it would work for you or not. From there, if you want to proceed, we could see you on that day if you wanted to proceed, or we could book you in for your course of treatments. It would be a course of 3, and it's a package that you would book. Essentially, we would see you first appointment, we'd see you a month later, then a month later after that. So that would be 3 applications you would have. You usually start to see significant results after the second treatment. The way that the tissue changes and the way that the immune system starts working into it is just quite astounding. You just really see it all shrinking down and coming in. And then usually by the time we get into the third one, we're really just putting the final nail in the coffin and letting it go. Now, after your third treatment, we see you back, and that's part of your package as well, 12 weeks later. So there's no additional cost for that. So you come back in 12 weeks later and we assess how it's all going. If it's not fully resolved at that point, we give you another dose of this in at that point, and that's all part of that package. So that would essentially be 4 treatments with this if it's required. Very unusual for you to need that, but it would hopefully just gives you some peace of mind that we will zap it again if we need to. Now, usually by that point, it's very unusual that they wouldn't have cleared. Now, usually at that point, we won't see you back after that. But if we were putting more another dose in, we would see you back again in 3 months' time again. There'd be no charge for that. Now, if it hadn't healed or hadn't resolved at 3 months, now, I've not heard of anything that's not had that. We would deal with it then, but we can then discuss whether we'd need to go into surgical options and things. But so far, I don't know any clinic that does Swift where that's been the case. So let's just not go there. But essentially, it is a very easy procedure. There is nothing that you need to do between appointments, like nothing. Like you don't need to spray anything on, you don't need to be rubbing it down, you don't need to be covering it up, you don't need to do anything with it, just leave it alone. There's no blood, there's no ghoul, there's no yucky stuff, there's no local anaesthetic needed. You don't need, it's super easy. You could literally just come in on your lunch break from work and you're zapped in no time. It really isn't eventful. It's hot when we're doing it at the time. It's 2 seconds, right? So you'll feel it, that's hot, and then it's away. Now, there's no pain afterwards, after it. It's not like it's like, oh, it's really, really sore. It's very, very unusual for anybody to feel any sort of pain afterwards. That's not something that I've had fed back in. So what we are doing for now, for the first month that we've launched this, is we are offering free consultations. So if you have got problems with a verruca, if you're struggling with your verruca, if you're really like demented, then please do get in touch. No matter if you've failed a treatment before, I promise you, we will thoroughly assess you and we will give you the best advice, even if that means that we say to you, we'll always be really honest with you, even if that means this might not be right for you. We will always give you a true answer. We will not sell you something that's not going to work for you. We'll always give you all the information so you can make an informed choice in what's best for you. And that might just mean that we send you away and we just give you advice, and there'll be no charge for that. It might be like, actually, this won't work for you, or this isn't right for you. And there's certain conditions in certain people where this wouldn't work, primarily things like if you had peripheral neuropathy and diabetes, we really need to be thinking about if this is best for you. There's maybe like pregnancy. We would not be doing this to somebody who's pregnant, right? Just leave it alone until you've had the baby. Anything that's really just making your immune system do something while you're pregnant, like let's not go there. So there's a few wee conditions where we would leave it. Now we can do this in children as well. We usually for children would reduce the settings down just so that it's not too uncomfortable for them, because it is hot. And that might be like, oh, but the great thing with this is that, there's no blood, there's no ghoul. A lot of some of the procedures, you might need a local anaesthetic, and that can be really, really scary, especially for young ones. So with this, it's literally on and off in 2 seconds. And we do that. Usually for kids, we'll try and get 3 in if they'll let us. And ideally 5, but we'll do 3 is that's a kind of good number. But usually we'll try and push it to 5, especially for adults. But we just see where that patient can tolerate it, because it is hot when it's on the tissue. You'll feel it hot, so it's like, oh, it's hot, and then it's gone. By the time you felt it, it's coming off. But we'll always be open and honest with you here. You will find that that can just be a little bit like, oh, I wasn't expecting that, or that just feels a wee bit hot. So that is Swift. It is now in the Rehab Hub in Glasgow. If you are struggling with your verruca, please don't hesitate to book a free consultation, and we will get you the best advice and help you as best we can.